There is an ancient video on YouTube called Why I Don't Use Sculptra that I need to update because I've had two patients in this last week ask me about if I should use Sculptra, which is something that I was surprised about. And then the second one explained to me that, yeah, there's something on Instagram or on the social media channels that talked about the benefits of Sculptra. So I thought I would go ahead and talk about it. So the first thing I want to say is that Sculptra is not a bad product. It's not a product that I had a lot of complications with, that I think it's not a good product, but there are a lot of reasons I don't use it now. And I first want to explain to you what it is, how people are using it, how I used to use it, and why I don't use it anymore. So Sculptra is a brand name for basically a poly-L-lactic acid. It is a material that's also used in dissolvable sutures. So the product itself degrades somewhat, but there can be a persistence of the base product. It's meant to stimulate collagen. The product is usually injected into the subcutaneous tissues, in other words, below the dermis, and in a zone of an area, and it's meant to build collagen and to increase volume of the face. Usually after the injection, the patient rubs the area, and then over time, over 4 to 6 weeks, it starts to build. And it may take a few rounds to see the augmentation of volume and the collagen improvements. So there are several reasons why I don't use Sculptra, and I'll talk to you about sort of, my history of using it. I did use it in the past. I gave up on it many, many years ago. I did reintroduce it briefly into my practice for a year or two into the neck area to improve collagen, and now I have, again, many years now, not been using it. So there are a few reasons why I don't like using it. First of all, oftentimes the product is injected, it's uncomfortable. I don't like pain. I'm not a big fan of pain. So that's one reason I don't like it. It can cause a lot of bruising in the area. Second reason is that it takes multiple rounds to see the change, which I don't like patients coming back every 6 weeks to do it, having massaged the area. Another reason I don't like it is the unpredictability of the products. And some patients they're non-responders. They just don't get much of a response in terms of volume, and some people respond very well and some people respond too much. So whenever it comes to volume, I don't like unpredictability, because if I give too much volume, it doesn't look good. If I don't give enough volume, you're disappointed. If it takes me 3 to 4 rounds to get there, it may not be the best thing. The other problem with the product is that in areas of high dynamic mobility, like the lower half of the face, especially toward the mouth, and even in thin skin like in the neck, there's a higher risk of nodularity. Nodularity is not a granuloma, it's not an infection, it's a clustering of the product that becomes a lump. Is it that common? The closer you get to the mouth, the higher the incidence. The farther away from the mouth, the lower incidence. Farther away from thin skin, the lower the incidence. So in terms of discomfort, recovery, unpredictability, these are all the classic reasons why I don't use Sculptra. I prefer fillers or fat in terms of volume. So if we sort of divide the skin into two problems, one is volume and one is skin rejuvenation, and you have to segregate it because, Sculptra is trying to do both of those things at the same time, and I don't think it's doing either one that well. But if I divide volume and skin rejuvenation into two categories, you can understand how I do it, and this is sort of a summary of a lot of the other videos that you may have watched. So in terms of volume, it's going to be fat or fillers. Around the eyes, to me, fat wins now because I've seen migration of fillers around the eyes. And if it's a large volume, fat is wonderful. There's some limitations of fat, which is that if you gained a lot of weight or lost a lot of weight, there can be some changes to the size of the fat particles. You need to know that. And fat is not a perfect take. It's not a 100% take, but it does very, very well in terms of a right brain improvement. In other words, when someone looks better. If you don't understand right versus left brain, watch my video on that subject I shot a few weeks ago, 2 weeks ago or so. So fillers are great because it's instant in the office. I can predict the volume when I inject it, but I've seen migration issues around the eye, so don't love fillers for that purpose. And we're talking strictly about volume. So I prefer fat or fillers over Sculptra in terms of predictable long-term outcomes with volume. In terms of skin rejuvenation, you probably know that I divide that into two major categories, minus RF microneedle lasers and other things that can help. But my two big weapons that are amazingly powerful is for static problems of the skin, mesobotox and Botox, and then for dynamic wrinkles in areas of corrugations when there's movement is going to be my dynamic fillers. So those are my two favorite therapies. So watch those videos. I have a 25-minute video on mesobotox and I've got a 15-minute video on dynamic fillers, but I'll give you a quick summary, is that Botox creates a molecular healing of the skin. Some stories I've told is a lady that last year had melasma blow up every summer. She did 3 rounds of the mesobotox. She doesn't even get that anymore. Now, does that mean it's permanent? No. Does it mean everyone is guaranteed after 3 rounds they don't get melasma? No. But it's the power is in the story of understanding what Botox is doing is actually molecularly causing a different processing of the skin damage, where it becomes much more resistant to rosacea, problems of molecular changes that are unfavorable to the skin. It creates a healing, if you will, of the skin that you simply cannot get with Sculptra. Sculptra does grow some collagen, but then again, Restylane can grow some collagen. I just don't think Sculptra is that predictable, and it certainly doesn't have the advanced properties of what Botox is doing to the skin in terms of healing. And then the dynamic fillers, again, please watch that video, but essentially what it is, it's cross-hatching wrinkles that when people are smiling, there are creases there. And Sculptra can help with that, but it's very unpredictable. It's not that reliable, and certainly the closer you get to the skin, the higher the risk of nodularity problems, where you don't really get that with this cross-hatching filler, the dynamic fillers. And I also can see that change. I'm actually sculpting that wrinkle away. So instead of guessing in 6 weeks after 3 rounds of this every 6 weeks that I may get some improvement at some level, I'm actually managing it directly with the filler, and it's not adding volume, it's cross-hatching that area. And again, if you want a much more detailed discussion about this, please watch the video on dynamic fillers to understand that better. So this is probably a better video in 2023 compared to the video I shot of why don't use Sculptra that I shot about 10 years ago.